When people have low oxygen problems, something like vascular disease, so we're talking about heart disease. What if your heart isn't pumping the blood around enough? Or what if your blood vessels are hardened and they're not moving the blood through so that every little capillary is getting the oxygen to it? What if it's not all getting oxygenated? Then you're going to start having problems. And it's not big problems like having a stroke. It's minor problems like your brain shrinks. I'm talking literally, your brain shrinks. You can do an MRI scan and see the brain this big, and then a couple of years later it's this big. Well, why did it shrink 20%? What the heck?
Hey, it works.
Oh,
Hello, welcome to the Healthy Heart webinar. See, that's where I needed that clapping cue. That
Yeah.
yeah.
I gotta work on that. I gotta be
You think
better.
one out of three of us would be like very technical to add all that, but sorry.
Zoom changes their stuff all the time, so
Yeah, I need the laugh track.
you could. Oh well. Okay, so anyway, hello everyone. Welcome to the Healthy Heart webinar. If you were with us yesterday, I invited a lot of you to join us today. So I want to know who's here because of the invitation yesterday. Go ahead and comment in the chat. We had a great webinar yesterday talking about type 2 diabetes, but today we're going to talk about keeping our heart healthy. And I think it was this webinar last week where we said, let's name all of the jobs that we know that Dr. Saunders has done, or all of the weird things that we know about him. And we thought of some good ones. Something interesting came up today. I don't know how much he's going to want to discuss this, but it brought us to a discussion about hyperbaric oxygen chambers. Chambers? Yeah, I guess that'd be the plural of it. And Dr. Saunders, I've heard about these. I've never used one. What is the latest research on these hyperbaric oxygen chambers? What are they used for?
Oxygen is very important to life, right? You need oxygen, and if you look at all over, just around the world, you see that people who live at high altitude, so people along the Rocky Mountains, for example, in Idaho, Utah, Colorado, New Mexico. Santa Fe, New Mexico is like 7,000 feet. It's a pretty high elevation. And I think it's Albuquerque, New Mexico is the highest metropolitan city in the United States. Everybody thinks, Colorado, Denver, Colorado, the mile high city. Salt Lake City, Utah is also around a mile high, so there's, but they're not the highest. Anyway, along that corridor, there's an increased risk of things like depression and dysfunction, even a lot of mental dysfunction. Depression is like a significantly higher, like all over the country, it's this level, and then you go to the Rocky Mountains and it's this level, and it's like, what the heck? Oxygen is like really important for the brain, especially to function. You need a constant supply of oxygen. So when people have low oxygen problems, something like vascular disease, so we're talking about heart disease. What if your heart isn't pumping the blood around enough? Or what if your blood vessels are hardened and they're not moving the blood through so that every little capillary is getting the oxygen to it? What if it's not all getting oxygenated? Then you're going to start having problems. And it's not big problems like having a stroke. It's minor problems like your brain shrinks. I'm talking literally, your brain shrinks. You can do an MRI scan and see the brain this big, and then a couple of years later it's this big. Well, why did it shrink 20%? What the heck? And they even expect that. A lot of times radiologists will say, well, normal shrinkage of the brain for age. And I'm like, what? Your brain should never shrink. And a lot of that has to do with a lack of energy supply. And some of it is like with diabetes, you don't get enough sugar there, but a lot of it's vascular disease, what we're talking about here, where you're not getting enough oxygen to the brain. So People, especially in high altitudes, but anywhere there's any kind of vascular disease or anything, are using hyperbaric oxygen to increase their oxygen. Now, what's really interesting, if you've had, as you've seen those oxygen bars where you can go in the bar and you get, and they give you the little nasal things you put on, you're connected to 100% oxygen, breathing 100% oxygen, right? That does not significantly increase your oxygen to your tissues. It does not significantly increase your hemoglobin, the oxygenated hemoglobin. The 20% oxygen that you're breathing in the ambient air is enough. Well, when you're at high altitudes, you actually have less, the partial pressure of oxygen. You have less oxygen pressure, so you're having less. So in those cases, those oxygen bars might be useful if you're at very high altitude. However, just like if you're at sea level or something, it's not really a thing. But when you put it under pressure, now you've increased the partial pressure of oxygen, where you can diffuse oxygen even into the fluid. Your serum, your plasma of your blood can carry oxygen, not just your hemoglobin. And it can get into all of the ends of your tissues and everything. So it can be useful for those kinds of things. But also when people have had strokes, a stroke is what? A lack of blood flow, lack of oxygen to the brain. And you can increase that oxygen by doing hyperbaric oxygen, because you can, under pressure, put that oxygen into tissues that don't even have any circulation. So you can actually improve the function of areas of the brain. And moreover, when you have something like a stroke or something like heart disease, where you're getting limited flow to the heart, the hyperbaric oxygen increases collateral circulation. So if you have a blocked artery, that artery is all plugged up, and you put under hyperbaric oxygen, your body will make what's called collateral circulation. It'll make little teeny arteries that go around it, around the blockage, and then so you'll get blood flow back to that area. So other things that oxygen is used for, hyperbaric oxygen, neurological problems, or you kind of talked about that, any kind of neurological problems. Anytime anyone has had radiation therapy, something like for cancer or something like that, you think, oh, I have a tumor. I just talked about someone today, endometrial cancer. So she has an endometrial cancer in her pelvis, and you think they're radiating that cancer, right? But you forget that all the tissues, but there's a cancer right here, and there's all the tissues in between the cancer and the outside, all of that's being irradiated all the way through. So she started getting bowel problems, a sloughing off of her rectal, her bowel. And so she was getting all these bowel problems from radiation damage to her colon. It had nothing to do with the cancer, but it was the radiation going through her colon to get the cancer that caused her to have these issues. So the radiation damage is actually really helped by hyperbaric oxygen. Certain types of infections cause low oxygen environments. And if you put in a bunch of oxygen, you can get rid of the infection very quickly, because oxygen will kill those bacteria that are creating this hypoxic tissue. Another one with infections, radiation damage. Oh, crush injuries. If you've had a crush injury where you've damaged arteries and you're not getting blood flow to the area, and it can get gangrene and require amputation. If you do it under hyperbaric oxygen, you can get oxygen into the tissues even when there's no blood flow, and you can maintain that tissue alive until you can get collateral circulation to allow blood flow to get there. So crush injuries is another reason. It's a big deal. Hyperbaric oxygen is really helpful for when used properly. So remember, there's a downside to everything, right? And I always talk about the downside. So it's not the panacea is going to cure everything. Remember that when you're doing excessive oxygen, you're oxidizing things. And that's the same as like using bleach. You're creating oxygen-free radicals. You're damaging DNA. You're damaging cells. You're damaging tissues. Oxygen-free radicals are not good for you. That's why we take antioxidants, right? All those antioxidants. Everybody take more antioxidant. People are popping pills like resveratrol and astaxanthin and zeaxanthin and all that stuff, so that they can have antioxidants. Well, that is a good thing to consider. If you're doing any extra oxygen, like hyperbaric oxygen, you definitely should be taking a lot of antioxidants. If you can get, like, if you're eating carrots, instead of having a few raw carrots, drink like 16 ounces of carrot juice, and that'll get you a lot of carotenoids, beta carotene and other carotenoids. Dark green vegetables have a lot of carotenoids in them, alpha carotene, beta carotene, gamma. And then vitamin E is very important for the fatty tissues like cell membranes, to protect them. And so you can protect yourself from hyperbaric oxygen by getting a very high level of oxygen-free radicals. And a great way to do that is in smoothies. If you're doing fruit and vegetable smoothies, and you just put a lot of greens in there, a lot of blueberries, blackberries, and you have this really, colorful, everything with color is in there, then you're going to get a lot of oxygen, antioxidants to protect you from that extra oxygen that you're getting.
And
Right.
Zan mentioned in the comments that he has a friend who was in the chamber because he was diving and he got the bends. So how does that work?
That's the original reason. Okay. So the reason hyperbaric oxygen was originally introduced was when people diving, they go down deep. When they go below 200 feet or so, they're breathing in oxygen, nitrogen, right? Just like normal. But because they're under so much pressure, the nitrogen dissolves in their tissues. And then if they come up too fast, that nitrogen, instead of just going back into the blood, will form bubbles. And wherever it forms bubbles, it can like block arteries and prevent blood flow from happening. The muscles will cramp up wherever the muscles, the nitrogen in the tissues. So what you have to do if you get that, you have to go into a hyperbaric oxygen chamber, and under this essentially the same amount of pressure, put everything back into solution, and now you're not breathing nitrogen under that, and then you slowly come out of it so that you're not adding in nitrogen because you're breathing oxygen, and that allows those bubbles to come out so that you can be normal again.
Wow. I'm going to show a picture of this. You can tell me, does this look familiar? Is this what you're used to seeing?
Yeah, that's a nice one. We have one of those nearby across the street. They have one here in Solvang, and they have two other ones too that are not glass. They have little windows in them, but like that, yeah.
That scares me a little bit. But
some people get claustrophobic in those ones that are entirely enclosed. The glass one's pretty nice because you can slide somebody in there, and it looks like they're out in the open and they can see everything around them, and so they don't feel claustrophobic. I remember seeing a picture of Michael Jackson in one of those.
Yeah.
Yeah. I never asked him about it.
Oh,
how long have these been around?
Yeah. Oh, these have been around for many years. 40 years ago, when I was in residency, we had one at Northridge Hospital. Yeah, it's been around for a long time.
Yeah, I'm hearing more and more about it. I think we have some locally, which I don't know how long we've had them, but with people who could have access to them outside of the hospital. I think they're in more non-traditional medical places now, is what I'm hearing. So
yeah, and a lot of them are using low pressure oxygen, where they get to 0.8 atmospheres is So it's not quite twice as much pressure as we're under 1 atmosphere. And those are fine for like the high altitude people that are wanting the extra oxygen from being at high altitude. That's all good. The ones that have like crush injuries and strokes and stuff like that, they really need to be able to get to 2 atmospheres or sometimes more. So the hard chambers are better for that kind of thing.
Interesting. Kathy had said, how would a hyperbaric oxygen therapy help someone with a cerebral palsy?
It was once thought that cerebral palsy was a deficiency of oxygen at birth because of a long birth or birth trauma or those kinds of things. But that probably isn't the case. However, any kind of neurological problem, it seems like getting enough oxygen induces repair. Now, people are going to run out and say, oh, I got to get hyperbaric oxygen. Like, this is really important. Well, not really. Actually, you can increase oxygen for other reasons. You can, if you exercise, for example, a good exercise routine, you don't realize it, but your oxygen, your circulation is bigger. You got to get that carbon dioxide out, and you're breathing more to get rid of carbon dioxide. But at the same time, you're increasing your oxygen availability to tissues by dilating blood vessels. So there's more than one way. You know, I kind of laugh at the oxygen bars. I'm like, go to the gym and work out. That way you get the double benefit. They actually have, in a lot of places, it's called EWAT, exercise with oxygen therapy. And so you're exercising and you have oxygen on. And that has some benefits to it as well.
So let's talk a little about breathing exercises. So we mentioned this on the webinar yesterday, Wim Hof breathing and that kind of thing. What is happening when we're doing that?
That's kind of a different issue. It's not really an oxygen or even a carbon dioxide issue. To some extent it is. Mostly it's about the autonomic nervous system. The autonomic nervous system controls your oxygen level, your carbon dioxide level, your blood pressure, your temperature, all those things that you don't have to think about. And so the purpose for the breathing techniques is to balance the sympathetic and parasympathetic systems so that they're properly balanced.
You're gonna ask something, Cheryl.
Oh, there was this interesting question. What about ozone mixed with your blood? What exactly is ozone? We're kind of in this oxygen topic today.
Okay.
But what is ozone, and can that help someone with blood problems or heart problems?
Ozone is O3.
Okay.
So oxygen is O2, ozone is O3. And it is a free radical, and it's just dying to give up an oxygen to something else. So it's this kind of unstable oxygen molecule. And you can make ozone. Everybody's smelled ozone, like when you zap something, that electrical smell that like if you've, I don't know, have you ever had a short circuit and something goes, and sometimes in motors, you can see the brushes, the little sparks in the brushes, and you can smell that ozone kind of smell. That's ozone, and it's around, and it's in the upper atmosphere. There's a lot of ozone, and that's what protects us from a lot of radiation, because it'll absorb the radiation and make the ozone will be made into O2, and then two of them will come together to make O2, so you get 3 O2s. And that's a protection that the Earth has from radiation, cosmic radiation, somewhat. But ozone, if you get concentrated ozone anywhere, it's an irritant, just like any oxygen oxidizer. It's an oxidizer. We use oxygen bleach, right, to whiten our clothing. That's kind of what this is. This is an oxygen bleach. So I've heard of people taking pure ozone and injecting it directly into a vein. And it irritates the vein, causes the vein to shrink down, and sometimes you lose the vein from doing that. But it's really good for acute illnesses. If you have like people with Lyme disease, people with Epstein-Barr virus, people with like acute illnesses, I've seen it work. I had somebody with pneumonia, and she was like super sick, and she got that treatment, and that she was back to work the next day. I'm like, no way, you had pneumonia. I mean, we like the X-ray was pneumonia, and her oxygen level was like way low in the 80s. And I'm like, you're going to be in bed for like 2 weeks. The next day, she was back to work after doing an ozone treatment. So I don't know. I've seen it work pretty well. And so, but again, remember, it's an oxidant. And so you're causing oxidation, you're doing damage. In the blood, it's not a big deal because all of your red blood cells, they don't have DNA. They're already dead. They're dead cells. They're just little bags of hemoglobin to carry oxygen around. They do have some metabolism. Someone's gonna get me for that. But basically, they're not metabolically active, so you don't damage them with the ozone. But the white blood cells you could, and then other tissues like the veins themselves can be damaged by the ozone.
A question here from Terry. First of all, I'm just going to let you guys know this wasn't even our topic that we were going to talk about today. We're just having some fun.
It works.
Yeah. I love this. This is great. Okay, so Terry said, does this help for AFib or high blood pressure at all?
Okay. No, neither of the two. So oxygen okay. So if you have hypoxia to your brain, for example, if you have a mild hypoxia because of constriction of your carotid arteries or something like that, and you do hyperbaric oxygen, your blood pressure will become normal. It's really amazing. But it's usually not a permanent thing. It's not like you can fix the blood pressure that way. But yeah, you can temporarily, at least temporarily, drop the blood pressure that way. And then the other thing was the atrial fibrillation. Atrial fibrillation is caused by a lack of energy to the heart. So if the problem with the heart is a lack of oxygen, then hyperbaric oxygen can fix the problem. And like I said, it has a long-term effect. It's not just something that happens that you do immediately. Over a period of time of doing hyperbaric oxygen, you get things like collateral circulation to improve blood flow and oxygenation. So I when I first answered, I didn't think long-term, but perhaps if that's the problem, that can be helpful.
All right, I want to quick mention that Dr. Saunders is not your doctor. So before you implement anything that we discuss here today, please check with your medical provider. I want to dig into some more of these questions. Lots of good questions about keeping our heart healthy. If you guys have more questions about these hyperbaric oxygen chambers or oxygen, all of that kind of stuff, we'd love to hear those as well. I'm going to get, we have some questions, I think, about type 2 that have come in. And then some about keeping our heart healthy. And then some who want to know how to do both. So we're going to dig into these. Michelle says, what are neuropathy symptoms and how does Nervala affect or improve it? Why would my internist say that mine is not due or related to diabetes? So not neuropathy.
Well, maybe if your neuropathy isn't the typical pattern of diabetes, then the doctor might say it's not related to diabetes. But we know neuropathy can happen long before you even get diabetes. So I don't see how anyone could say that any kind of neuropathy is not related to diabetes, because if you have diabetes, you can get neuropathy from head to toe. You know, neuropathy of the brain. That's Alzheimer's or dementia, which is the #1 cause is diabetes. So, you know, that's the head, and then the toes, of course, your peripheral neuropathy that primarily or first affects the toes and then moves up gradually up to the knees. And usually by the time it gets to the knees, you start feeling it in the fingers. So there's sort of a typical pattern. But since it can happen in the brain, it can happen anywhere in the body. So the question of what are the symptoms of neuropathy, anything that the nervous system affects. What is that? Well, everything. Neuropathy could be cramps in your muscles because the nerves going to the muscles aren't working right. And so you can get cramps in your muscles because of neuropathy. It could be a sensory neuropathy where you're getting pins and needles or total numbness or burning or aching. You can get neuropathy in the that's the sensory nerves, and then the motor nerves that control your muscles, so that you lose control of the muscle, getting weakness or spasms, cramps, those kinds of things. And then remember, your autonomic nervous system controls your blood pressure, your heart rate, your breathing, your temperature. And so you can get temperature instability, that's neuropathy. You can get blood pressure instability, that can be neuropathy. So anything that the nervous system affects. And so just about anything, any function of the body is affected by the nervous system. So neuropathy can show up anywhere.
And does Nervala help?
Okay. Nervala might help. Well, remember, there's a caveat to that. If the problem is a lack of blood flow, like in the peripheral neuropathy, where you have the tiny blood vessels that can't get blood through them because the glycocalyx is damaged, and you need the vitamin B1 in there, which is the benfotiamine, or you need antioxidants like alpha lipoic acid, which is a fat-soluble antioxidant that can get into those cells and get rid of that oxidation. Then if that's the problem, Nervala definitely helps. But if your problem is because your blood sugar is high and your nervous system, like your brain, isn't getting any energy, then Nervala is not going to fix that problem. You have to fix that by fixing what the cause is, the root cause. So in diabetes, you should always look at the root cause as insulin resistance. That's the primary cause of all of these. It's the underlying cause of all of these. And Nervala helps the immediate cause, but not really the underlying cause. You still have to fix your diabetes.
Okay, and I'm going to again share my screen because I just want to show you guys Barton Nutrition. Did I click the right thing? I think so. Okay, here is bartonnutrition.com, and you will find all of our supplements, and I believe, actually, I might have made this up. I was thinking that our solution kits were there. Look at those guys. Look at those young kids down here.
Dang. I used to be that young.
My hair used to be that blonde.
We don't have the printed versions on the Barton Nutrition site.
So let's go to bartonwebinar.com. I'll show you that. That's kind of the hub for these webinars anyway. So there's that guy again. And so this is where you would register for the webinars. You can also see some of our latest. We take all of the webinars that we do and we upload them to YouTube. So if you were to click on one of these, it will take you to our YouTube channel where you can subscribe. Highly recommend you do that. And then down below, frequently asked questions, we have products, and we have solution kits as well. So when we mention the Healthy Heart Solution Kit, this is the book that we're talking about, or the Diabetes Solution Kit, this is the book that we're talking about. You can purchase these here. If you use code webinar25, you'll save 25%. But I just want to remind you that these solution kits are what Dr. Saunders would recommend to the patients that come into his office. And he's worked with our team, and we put this information together. And this is a lot cheaper than a visit with Dr. Saunders. I'll just say
a lot cheaper.
Yes. And you get to come on the webinar and ask questions about it. We want to help you through your journey. And so I just would highly recommend, if you're looking to keep your heart healthy, or reverse type 2, etc. Those solution kits are really important.
I was thinking about this yesterday about how, our program, how unique it is. That, in a way, it's a commercial program, but when you think about it, our purpose here is not primarily commercial. That's really a secondary thing. Our primary purpose is really to help people be healthy, and so the purpose for the webinar is what about individuals? You can put out a book and say, look, everybody do this, and then people try and that doesn't work. Or what about me? Or I don't fit into that situation, or how come this isn't working for me, and all that. And the webinars allow everyone, like, individually to ask questions and go, okay, how does this apply? And then you can hear other people ask questions. You go, oh yeah, that I've had that, and so everything isn't in the book, and you can't, because every person is an individual. And so we make it free for everyone because we want everybody to be healthy.
Yes, love it. All right. Next question. Here we go. Okay, so we have a few questions here from Beverly, so I'm just going to read these together. Okay, what to do when the diabetes solution kit seems to disagree with the healthy heart solution? For example, don't use fiber greens when limiting carbs on the diabetes solution protocol, but do use fiber greens for a healthy heart. Let's do that one.
Okay, you can answer that.
Well, yeah, so we have a lot of people who ask about this, and the recommendation that I would say is you can still have a lot of fiber while you're doing the diabetes solution kit. Now, Dr. Saunders doesn't recommend, of course, the fiber greens if you're doing the diabetes solution kit, not in phase 1, not till you know how you respond to sweeten things. Any type of sweetener, guys, any kind, even though it's stevia, monk fruit, all those questions, your body may still respond to those just like regular sugar. So take what you know about the diabetes solution kit, add in fiber. That's what I would say, right? Add in more fiber for a healthier heart. Anything else?
Yeah.
Okay.
And the reason there's a difference there is because when you have diabetes, you don't want sweeteners, and there's stevia in the fiber greens. So that's why.
All right. And then Beverly said, are there any modifications to either protocol when you don't have a colon? Mine was removed in 1984. I'm careful about hydration, but I know that the colon absorbs some minerals usually.
Yeah. If you don't have a colon, then your diet is actually going to be very different in that you're going to have more of a low fiber diet. I mean, we always talk about you want more fiber because it lowers the cholesterol and it has so many benefits in the colon. But if you don't have a colon, then what often happens is you end up with a lot of loose stool. So your diet's going to be very different in that kind of a case, and that kind of has to be individualized.
Okay. All right, let's keep going here. Lily says, did I hear correctly last week, Dr. Saunders say that no flush is bad for your liver?
Yeah, there was some studies that showed that liver damage, the liver enzymes were elevated in people taking the long-acting no flush niacin. And so it's niacin, it's sustained release or slow release niacin that seemed to be the problem.
Right. Danielle says, my doctor says my cholesterol is low and to eat good fats to bring it up. What should I eat?
Hey, eat anything with omega-3. So eat fish and get flax seeds and chia seeds. And use olive oil, and coconut oil is actually fine too. Coconut oil is a pretty good oil to cook with. So yeah, that's good. So if you're doing if you're increasing fat, just make sure you get enough fiber with it.
Okay. Kathy had said, why are the hyperbaric oxygen chambers or the therapy so expensive?
Okay, that's a good question. So the reason oxygen is so expensive, the hyperbaric oxygen, um, there's two different ways of doing it. One is the low pressure chambers with an oxygen concentrator. And that's just taking oxygen out of the air. It's concentrating the oxygen, it's spitting out nitrogen, and you get more oxygen at an equivalent rate of in your nasal cannula. You're getting 5 to 10 liters of oxygen per minute is the amount of oxygen that they're putting through there from this machine that concentrates oxygen. And that's relatively low cost. The chambers themselves are pretty expensive. They're in the tens of thousands of dollars and going up easily $100,000 for the larger ones that are all glass and all that. Whereas the smaller chambers that are zippered ones that are nylon, those are less expensive, but they're not as high pressure either. You can't put 2 atmospheres of pressure in there. So the medical grade oxygen is you have to have a big tanker truck come in with oxygen and fill your oxygen tank like they do at hospitals. And that stuff is really expensive, compared to an oxygen concentrator. So there's a lot of expense to running these, and I know the one that I work with, they try to keep the costs low. It's between $200 and $300 for a dive, and for each dive. So if you're doing 10 treatments, that's $2,000 to $3,000, which is a very small amount. It would not be enough to keep the clinic open. It's really like insurance, like Medicare. They'll pay $500 to $1,000 for a dive, depending on the length of time and percentage of oxygen, which chamber they're using, and all that. So, and the reason for it. But the insurance only has a very narrow. They only cover a few indications. If you have any neurological problems, they won't cover it. So you have to pay cash. So, it's one of those. It's really hard to keep the cost down when the types of things you're using are really high priced.
Why is medical oxygen so much more expensive, medical grade?
Because you have to get pure oxygen. So medical grade, it has to be tested, purified. You can't have any impurities in it. It doesn't allow for any other, like nitrogen or helium or other gases in there. So because it has to be purified so much and tested and everything, it's if you were doing industrial grade oxygen, like someone with a welder can get oxygen, that's more or less pure oxygen. But if it's impure, nobody cares. So it's not a big deal. They don't even have to test it.
Good question here from Terry on Facebook. Actually, I can move this over here 1 second. Can umbilical stem cell therapy be helpful for heart disease?
Okay, that is a good question. And the answer is, I don't know. When stem cell therapies were looked at for heart disease, it is amazing. I mean, when they were doing dogs and they would tie off an artery and kill part of the heart, it's dead. And then they untie the artery, or actually they let blood go in there, and they inject the dog's stem cells into that heart stem cells. It like grows a new heart, and it's like a baby heart. It's not like a 20-year-old or 30-year-old, 50-year-old heart. It is a baby, brand new, spanking new heart that those stem cells grow. So the answer is yes, stem cells can regenerate tissue. Yes, even the heart. So then the question is now going to, what about the umbilical stem cells that they put in your peripheral vein? Where do they go? Well, they marginate all over the body. They're not going to go specifically necessarily to the heart. So that's where the issue comes in. And then do you have heart disease where you have blockage already in your heart. And there's already some, the blood is not flowing well to that part of the heart, and that's why it died in the first place. So now you have poor blood flow. And what are the stem cells going to do? They don't have good blood flow. They don't have good oxygenation. They don't have the nutrients necessary to regenerate a new heart. So the studies on that are really sparse and not really beneficial. And I've seen cases. I had a woman who had renal failure, and she looked around and she went to this stem cell place in Panama, and she got some donors to donate money so she could do this. It's tens of thousands. It's a lot of money to have this done. She had her own stem cells removed from her fat, and then spun down, and they put them back in to her peripheral veins. And the idea was to regenerate her kidney function because her kidney function was gone. And it didn't help at all. So I started looking at that, and the research with using either autologous or umbilical stem cells is really sketchy. It's not, the research is sketchy, and some people say, well, this showed this, and if you really look at the research, it's not as good as they say it is. So what's the best way to use stem cells? And I'm going to tell you the best way to use stem cells. Here's the problem with stem cells is if you are catabolic, your stem cells don't work. Your umbilical stem cells won't work. Your autologous stem cells won't work. Whatever else they use, placental stem cells, whatever else they use, they are not going to work if you're catabolic. So you need to be anabolic. And we've discussed that in this program several times. You want to go back and review that. It's the 6-10 reset, where you stop eating by 6 and you sleep by 10. Because if you go to sleep with an empty stomach, then you start to become anabolic. When you're fasting, you become anabolic. When you're eating, you're catabolic. So a lot of times people are doing stem cell therapies on catabolic people, and that's like the old way of they used to inject human growth hormone into people who were catabolic, and that's an anabolic hormone, and all that does is create cancer. So you have to be really careful with the way people are presenting this and the way they're doing it, and whether it's going to work or not depends more upon what we like to say the soil. That's you, and there's so much that goes into the soil, and that's what are your eating habits, what are your sleeping habits, what are your exercise habits. You create your own stem cells. Everyone has their own stem cells to repair everything every single night if they will become anabolic every single night. They repair their joints so they never have to have joint replacements. They repair their kidneys so they don't get kidney failure. They repair their brain so they don't get Alzheimer's disease. And this is proven. And so the 6-10 reset is not a minor thing. It's a big thing. And especially if you're going to do something like stem cell therapy, if you're going to be eating and you're going to be anabolic, forget it. It's not going to work. Even after you pay $20,000, it's not going to work.
Yeah, if you want to go learn more about the 6-10 reset, I mean, we talk about it a lot, but there are many webinars that we've done on YouTube where we specifically dive into that. So definitely check that out. That is really important. Okay, I want to ask one more. I'm getting all these messages that are coming across Facebook here. Sorry. Dorothea on Facebook says, does nattokinase clean arteries?
Nattokinase is an enzyme that dissolves clots. So as far as cleaning arteries, the answer is potentially yes, maybe. Because if you have clots and they need to be dissolved, nattokinase can help to dissolve those clots. And that's been shown in a lot of different studies. And if you want to read more about it, Dr. Stephen Sinatra, as a cardiologist, did some research on this, and using both nattokinase and lumbrokinase, and with good benefit. And so, yes, that can help clean out your arteries.
All right, so many good questions today. This is great. Daniel had asked, is there a way to reduce your calcium score?
Good question. I think the answer is no. And here's why. My experience is that once the clot organizes means it's scarred, and the calcium is deposited in there, then that doesn't go away. And in fact, it gets worse. So here's what happens. Gosh, I wish I could use dibujos. I wish I could use pictures. Think of an artery, and you have this kind of an area where there's a clot in the wall of the artery, and that clot organizes. So like the fibrin gets taken out, and you get scar tissue in there. Essentially, it fills in with collagen and keratin, protein fibers. And the calcium is deposited in there because of that inflammation that's going on. So you have calcium deposits. But on top of that, you have another clot that is not organized. That's called soft clogs. There's the hard plaque and soft plaque. So the soft plaque is not calcified yet. So and you don't see that when you do the coronary calcium score. But you have some soft plaque there wherever the hard plaque was, essentially, or in other places. And then, you do all this great program. You're doing the Healthy Heart Solution, and you're doing really well, and you don't have chest pain anymore. I actually had a case of this, and so you go and do a coronary calcium score, and it's worse. It's like, what the heck? I've been working really hard on this. And so I had somebody who was just devastated because his coronary calcium score was worse after he'd been working so hard to improve his heart disease. But what happened, this is my theory, and I talked to a cardiologist about this. You have that hard plaque that has the calcium deposit, and then you have some soft plaque that has no calcium that's not measured in the coronary calcium score. But a year later, that soft plaque is now hard plaque. And so now you have more hard plaque than you had before because you had the soft plaque. But so what's different? Well, I'm assuming that now from now on, you're not forming any new soft plaque. And so you're not going to get any new hard plaque. But the soft plaque that's already there is going to harden and become calcified. I don't know. I don't have any research on that, and there's no good way. And if you look it up, like try to find soft plaque, hard plaque, there's no like imaging to distinguish those two, because soft plaque looks just like a blood vessel in blood to the CT scanner. The only reason you can measure the hard plaque is because it has calcium in it, and calcium absorbs the X-rays. So where there's no calcium, you don't see it, so you can't tell. That's why it's kind of hard to tell. So that's the very long answer to your very good question, and the answer is no.
Great, that's good. We are running out of time. Okay, Sienna says, I've developed brown patches of skin color on my lower legs, and they turned dark purple skin color last year. My doctor says it is venous stasis, and it's not related to my type 2 diabetes. Isn't it? Also, can Nervala help my case?
Okay. Nervala wouldn't be the best thing. So the venous stasis, those are areas of the skin where it's not getting enough blood. It creates a hypoxic area. The hypoxia does damage. You actually get more melatonin being produced, so you get these darkened areas. And that the turning purple is when the veins inside, the blood is just not moving through, and it creates the purple patches. And if you let those go, then they become ulcers, and they ulcerate because there's not enough oxygen getting to there, and the cells die. And so you create an ulcer because it's just dead cells at that point. So it's not a minor problem, and it's not something you pop a pill like Nervala for. It's something that really needs to be worked on. So depending on what the issue is. So if you have swelling, edema, you've got to get that edema out of there. Whenever you're sitting down, your feet need to be up. Whenever you're lying down, your feet need to be up. If you're walking or up on your feet, you need to have tight stockings on, compression stockings that put pressure on those outside veins, so to get the blood going back. And then when you're sitting down, you can take the compression stockings off and put your feet up and let the blood drain down. There are a few herbs that can help. So there's an herb called horse chestnut seed extract. The horse chestnut has a lot of bioflavonoids in it that help circulation. When there's inflammation there, there's something called French maritime pine bark extract. Are you getting all this down, Leslie? And those are two things that can improve circulation somewhat. And the more bioflavonoids you get, the better. So if you're eating a lot of fruit and vegetables, you're getting a lot of bioflavonoids, that actually helps the veins to function better. And then the mechanical ways are keeping your feet up and putting compression stockings on. Oops.
I wonder how many emails I'm going to get with some more questions about this. We'll have to get this to YouTube right away because this is good. Okay. When evaluating blood pressure and heart function, how crucial is it to evaluate pulse pressure? And if so, what is the ideal pulse pressure measurement?
That's a great question. So pulse pressure refers to the difference between the systolic, the high number, and the diastolic, the low number. And some people have a very narrow pulse pressure, and they have a low systolic and a high diastolic, like 110/90 is a very narrow pulse pressure. That's a sign of a lot of stress. You have the high diastolic. And then you have a wide pulse pressure where you have like 180/70. And that's a sign of hardening of the arteries. If the arteries are like pipes and they're really hard, the blood has to pump in there, and it pumps the blood into a hard pipe. And so the pressure goes up really high because the pipe's so hard, it's not compliant. If you feel your pulse, you can feel your artery actually going boom, boom, boom with the heartbeat. And if it's hard, then you're not going to feel that. And so that's the wide pulse pressure. So is that important? Yeah, they give you indications of what's going on. If you have really wide pulse pressure, then you have hardening of the arteries. Narrow pulse pressure is an indication of a stress response.
2 questions about vitamin K2. Let's see, Douglas said a few weeks ago, I asked about calcification, and Dr. Saunders recommend taking extra vitamin K2. Is it possible for that to help reduce the calcification? And also Peter had said, what about vitamin K2 moving calcium in arteries to bones? Won't that reduce the calcium score?
The answer is possibly. There is some good evidence. There's research that shows that a high dose vitamin K2 does actually move calcium out of soft tissue and into bone. And so, moving the calcium from the blood into the bone as well. However, my experience with the coronary calcium score, it's not that easy. And I've done several cases, but my cases are limited. Okay, so these are just my personal experience. And then the research shows it's possible, but I haven't seen a case of it yet, even with someone taking 45 milligrams of vitamin K2 every day. So I don't know.
Okay. Sienna wanted to know if you could spell the herbs from me. Horse nut extract. That was one, right?
Horse chestnut was one.
Yes.
And French
Yeah, and
pine bark.
yeah, the French pine bark extract. It has another name, pycnogenol, Pycnogn GENOL, pycnogenol.
And then Robin had asked, how effective or efficient is it when using a small oxygen backpack when you take a mile or so walk?
Okay, if you have a difficulty getting oxygen to your tissues, if your lungs aren't working, for example, very well, if you have emphysema or something like that, or there's fluid in the lungs, people with cancer, the extra oxygen adding in, so you're getting 50% oxygen instead of 20% oxygen, that will make a difference to them, because then more of their blood will be oxygenated, and so they'll have more oxygen. So that's why you see people walking around with the backpacks and the things. It's not an EWAT thing. So that's the question: is the walking around with the backpack and the extra oxygen? As you're exercising, right? I don't know. The EWAT therapies I've seen, they're like you're on a treadmill, like doing some pretty heavy exercise, or you're on a stationary bike doing some pretty heavy exercise, or Nordic track or something where you're and you're breathing pure oxygen. I don't know. I haven't seen research on lower levels of oxygen and lower levels of exercise.
Final question, because we're out of time. Sonia says, is 102/66 a good blood pressure?
102/66 is great if you're under 50 years old. If you're over 70, it's a terrible blood pressure. Yeah. So.
Any other information about that? Why is it?
Yeah. Okay. So, the assumption is, just to make it simple, the medical profession, doctors, to make it simple, they have a number that is the optimum blood pressure for everyone, and it turns out that's not the case. That your blood pressure is going to be different. Your optimum blood pressure is going to be different than mine, for example. Women are different than men. Older people are different than younger people. And so if you're a young woman and your blood pressure is 110/60, wow, good, more power to you, awesome. But most of the studies were done in middle-aged men, and middle-aged men, 120/80 seems to be an optimal blood pressure. And if you drop it lower, your death rate goes up. So you don't want a 110/60 blood pressure. That would be a bad blood pressure for a middle-aged man. And so it's not a simple question of what's everybody's optimum blood pressure. It's what's optimum for you. And so the optimum, apparently, from the research that I've been looking at, the long-term, the good research seems to be, if you're over age 70, 140/75 seems to be optimal. And that 75 number really doesn't change very much. It's a little more to the lower side if you're younger, and a little more to the higher side if you're older. But that 120/80 is fine if you're a middle-aged man. But if you're older, 140/75, that's pretty much the optimum place to be.
Okay. All right. That's it for today. Thank you, guys. Thank you, Dr. Saunders. We'll see you next week.
Thank you, Dr.
All right,
Saunders.
next week. Bye.
See all of you guys next week. Head over to bartonwebinar.com to find all of the things about our webinar. And don't forget to use code webinar25, one word. That's it.
All right.
See you.
Bye.
Bye.